Today we're going to talk about hand, foot, and mouth disease and what to do if your little ones get it. There are a few things you should know about hand, foot, and mouth disease and the recommended treatments. The Coxsackie virus is the known cause for this common childhood disease. While hand, foot, and mouth disease is more common in children, adults can get it too and pass it on to others. Sometimes they have no symptoms at all, but you can still spread the infection without knowing it. So how does it spread? Hand, foot, and mouth disease is spread by bodily fluids, which explains why it travels like wildflowers in places where young kids hang out like daycares and schools. The virus is easily spread to hard surfaces like shopping carts, toys, tables, cups, utensils. A person can pass this virus through blisters that happen with a rash, mucus in their nose, saliva, and even contact with your poop. It's important for parents to teach children to wash their hands often and properly to help prevent infections. Effective hand washing is the most important thing you can do. Wetting your hands with water, applying soap, and scrubbing the fingers in between the fingers, the thumbs, the palms at least 20 seconds. It would be like singing happy birthday. To minimize the risks of getting it and passing it on to others, say no thank you to hugging, kissing, sharing utensils, cups, toys, and other items with people who are sick and have this. Make sure that they're washing their hands, your kids are washing their hands, and so are you. So how long are you contagious? Even after the symptoms disappear, your child can still pass the virus to others. Hand, foot, and mouth disease is highly contagious through oral secretions and your stool. Once the fever and symptoms resolve, the virus is no longer in your mouth. It can still remain in your poop for several weeks following infection. Therefore, you can be exposed to the virus by a child who appears better and has no symptoms. Again, practicing good hand washing techniques and oral hygiene will help reduce the risk of passing this on to others. What are the symptoms? While the rash is a telltale sign of hand, foot, and mouth disease, what can happen is other symptoms. The rash is what distinguishes this virus from others. It's made of small red bumps and blisters on the hands, feet, and around the mouth, kind of like cold sores and fever blisters. They can also be on the groin area and your arms, face, and torso. It can cause a rash and small sores in and around your mouth, making it very painful. Hand, foot, and mouth disease is capable of causing a variety of symptoms, including fever, fatigue, muscle aches, runny nose, congestion, sore throat, vomiting, and diarrhea. The fever from hand, foot, and mouth disease can become very high. Treatments, although there's no cure, there are things that you can do, and treating it mainly consists of keeping your child comfortable with over-the-counter pain relief for fever and painful mouth sores. Cold drinks, ice, and popsicles help minimize the sores in the mouth. It usually takes 5 to 10 business days for it to run its course. I've actually used a few drops of peppermint oil mixed with coconut oil in a small spray bottle and sprayed it on the hands, feet, and mouth for my daughter and for friends. For children over the age of 1, make sure you're giving them fluids like chicken broth, apple juice, and even water. You can rinse their mouth after or before meals with liquid and acid, as long as it doesn't contain aspirin or benzocaine for little kids. Both of those things can be toxic and harmful for children that are small if they get too much. If your child is over 4 years old, you can use throat lozenges or sprays that numb the area. Children over the age of 6 who are capable of spitting, you can use a half a teaspoon of salt water and 8 ounces of water as long as they can gargle, swish, and spit. And you can use it 2 or 3 times a day as needed. Watch out for dehydration. Children who are not drinking and swallowing because of the pain can get dehydrated very quickly. Managing the pain and making sure they're getting fluids is important. Some children may also have difficulty swallowing. Painful mouth sores usually come with hand, foot, and mouth disease, but they can also lead to severe complications from dehydration, which might require IV fluids if you're not careful. Other complications, while most cases clear up in a couple weeks with no lasting concerns, rare occasions complications can occur due to dehydrations. As with other viruses, Coxsackie viruses can affect other areas of the body, like your brain and spinal cord, what results in meningitis or encephalitis. It can also cause heart infections, Hand, foot, and mouth disease is one of those childhood illnesses that can keep coming back. And according to Mayo Clinic, it's something that is preventable by making sure that you practice proper hygiene. Gradually, your child will build antibodies against this virus and reduce their chances of getting it back again. I know I sound like a broken record, but hand washing is the best way to prevent spread of hand, foot, and mouth disease. If you have any other questions about hand, foot, and mouth disease, there's a link below to a PDF and to Mayo Clinic to get more information. You can also go to dentalhygiene411.com, and there are several ways that you can connect with me and I can help you through this. If it's severe and your child has high fevers and it doesn't seem to be going away, make sure you contact a doctor to see what's going on. As always, hope this was helpful. Thanks for listening. Hit the like, comment, and subscribe. And if you'd like to make sure that you get notification for new videos that come out each week, hit the bell and you will get notified. New videos should come out every Monday, as long as nothing comes up in the world of life. I went 2 months without posting a video due to cancer and a devil's mastectomy. So hopefully there's no more complications in that and the videos will start to be consistent again. So thanks for watching. Hope your child does not get hand, foot, and mouth disease because it's pretty miserable for them. Good thing it only lasts no longer than 2 weeks. Thanks again for watching, because a healthy mouth is a healthy body and a happy, healthy life.